I think there is way too much hype and extrapolation about because these have gotten so smart so fast, therefore people will be obsolete in a certain amount of time. I think that is foolish and dangerous and harmful to people to talk like that. I think that the extrapolations there are completely ignoring the need for having an entity that has a mind, that knows what is true and false, that knows what matters, and that has emotional intelligence.
My name is Magenta Strongheart, and this is The Bomb, Engineering a Path Forward. This week, we discover what in the world affective computing is, how to make technology more empathic, and how wearable tech can save lives. Rosalind Picard is the founder and director of the Affective Computing Research Lab at MIT and co-founded both Affectiva and Empatica. Both companies are aimed at using extensive AI and wearable tech to improve the lives of people with chronic illnesses and make robots act a little more human. Ironically enough, she never wanted to start any kind of company, but the need for better data and better measurement tools pushed her past the point of research and into the public sphere of engineering consumer products. This is my conversation with Rosalind Picard, and this is The Bomb. We live in a time where design and technology touch every aspect of our lives. But where did it all come from? Who designed it? How was it built and brought to market? What will it look like in a year, 2 years, 100 years? From the phones and smartwatches that help us in our day-to-day to the cutting-edge spaceships and 3D printers that are leading us into the future, modern design is constantly shaping the way we work, communicate, problem solve, and play. And every new design, big or small, starts with an idea and a bill of materials. I'm Magenta Strongheart, and this is The Bomb, where we talk to leading innovators in the tech world and celebrate the transformational power of design. Awesome. Thank you so much, Rosalind. I'm really excited to have you here on the Bomb podcast. And I know you must have an incredibly busy schedule. From what I've learned in my little amount of research I've done before our conversation, you manage a lot of things. So I appreciate you taking the time out to talk with us. And I'm excited to learn more about your research, your kind of background getting into this work, and what you're doing with Empatica and Affectiva. So before we get into it, did I say that correctly?
Yes, that was perfect.
Okay, just want to make sure.
And I just wanted to say it's a pleasure to talk with you too. It's really wonderful of you to reach out.
Thanks, Rosalind. So before we get too far into the kind of current technology you're working on and the exciting things you're doing with these two companies, I'd love to just rewind a little bit and learn more about your background and how you got into engineering. So if I understand correctly, you did an undergrad in electrical engineering and then a PhD in electrical engineering later on and computer science at MIT. So if you could tell us a little bit about what brought you into that, even if I know sometimes it can be a long story, but even if there's early moments that really inspired you to get into making things, understanding how things work, I'd love to learn more about that.
Thanks. I was not one of those children who was really interested in science, to be honest. It was my least favorite subject. I didn't get interested in engineering until I took a test in high school trying to figure out like what to do with my life. And I was, good at math and science and also English. And it was suggested that I learn more about engineering. I had actually never met or heard of engineering really up until that point. And then when I realized it was the core of understanding all the like cool technology around me, I thought, wow, I could really learn how all these things work. And so I set out to study it at Georgia Tech. Also, I heard it was the hardest major, and that appealed to me. And as I learned more and more, I studied computer engineering in particular, learning how to design the insides of computers. And then later took a job at AT&T Bell Labs, designing computer chips, and also got into MIT's electrical engineering and computer science program, where I did a master's and doctorate, also in designing the insides of machines and thinking about the human brain, and then trying to build better algorithms and things that would run on those architectures that would imitate the human brain. That's where things really took some interesting twists.
So interesting that it all came from this early survey. I love that served you so well, because sometimes I'm sure people are like, this is not helpful or not, leading me anywhere really informative. But I love that it kind of relates, I feel like, to your interest now in understanding others and how they think. And you were probably like, I want to understand, what is the right path for me by figuring this out and kind of answering these questions.
There was a point where my advisor said to me, these are really interesting computer architectures you're designing, but what runs on them? And I was so inspired by the human brain that I thought I need to know more about how the brain works. And I was thinking of it more from an engineering perspective. And I started working on computer vision and working not just on the algorithms, which at the time, interestingly, we called machine learning and pattern recognition, and it was called not AI. Very, very funny, because when I first started teaching it, the first day I had to say, this is not AI, this is pattern recognition, but it's useful. And today, the AI is built on machine learning, the AI that's most useful. But at the time, I was just interested in algorithms that would run and do things similar to what I thought were so impressively intelligent in the human brain. And as I studied how the human brain worked, one day I learned that there were regions deep in the brain involved in perception that we had not studied. We had always studied the outer part of the brain, the cortex, the visual cortex, the parts that an EEG sitting on your scalp could read signals from. And suddenly I'm learning that there are these deep, older regions in the brain that were involved in perception. They were involved in particular in attention and in memory and emotion. And I thought, well, attention and memory are important. And I don't want to have anything to do with emotion. That would ruin my career, I thought at the time, especially being a woman in engineering. So this was actually a really pivotal moment to learn that those parts of the brain were really useful for perception.
The companies that you now have, how did they come out of the research you were doing, and what was the kind of timeline from, I mean, it's clearly directly related to the work that you were doing even in your doctorate. But what was had you already come up with some of these ideas during that time and then decided to start a company and commercialize some of these solutions right after completing your doctorate? Or what was the kind of timeline and space in between that led to being able to commercialize those?
There was actually quite a span. I was really interested primarily in the, coming up with better algorithms that were smarter and did more useful things, and in understanding increasingly how the brain worked and how emotion played a role in that, when I learned that emotion was actually essential for intelligent decision-making and perception. And that was really a difficult challenge to try to build this area in a current that thought that emotion should not be taken seriously. But I kept trying to bring objective measurement to it. It meant that we had to build our own devices to gather data. And so we started to build devices that could get the kind of physiological data with great quality in real life. And at this point, I had no interest in a company. I actually thought business was kind of the dark side. I just wanted better data. And we couldn't buy anything to give it to us. So, and in fact, you couldn't even, in theory, you couldn't even measure the things we were measuring in a comfortable way. You had to strap them to uncomfortable parts of the body and walk around with duct tape on you to get the data. And then when we built those devices that gave great data, suddenly everybody was asking us, like, can I have one? And they were saying, can I have your data? And these same conferences where people said, did she really do respectable stuff? They were coming up to me and saying, we want to work on this now.
Eating their words. Yeah.
And I'm like, great. I'm happy to share data.
Of course.
This is a big area. It needs a lot of people. Let's collaborate.
Well, that's great. And I love hearing, I think usually, some of the best ideas come from a need that we might have ourselves, right? Like this came out of you guys needing to make more effective tools for the research you wanted to collect. And so these solutions came out of a need of this, you couldn't find it, what you needed. And it's incredible to talk to someone who's been doing machine learning and pattern recognition and, AI before it was called AI, and to now be in a world where obviously it's very, it's a hot topic at the moment, in the last couple of years. I would be interested to hear kind of your perspective on what that evolution has been like to be at the front seat of that, and how are there any things, I guess there's a lot of questions I could ask, but first question, is there anything you're surprised hasn't kind of gotten further in this work, whether it's in, healthcare, the specific spaces you're addressing, or just broadly as far as the adaption and the use of it, in the world?
Actually, mostly things have moved fast or faster than I expected. I'd say the one thing I think is not moving as well, there are two things that aren't moving as fast as I think they should that I'm familiar with. One is the medical area. The medical area, it does need to be conservative. It does need to check everything. And maybe with respect to large language models, in some cases, people are, making some poor decisions. I think there with some of the large language models, putting them into situations where they will make bad errors and not properly compensating for those right away. But there are other areas of AI where the data and the behavior can be well characterized. And medicine, I think, needs to focus on those and maybe move a little faster than it's done there. I think that can bring a lot of good to people. I also think regulations haven't moved fast enough. And part of that is the lack, I think, of technical people's interest in getting involved in them. It's not fun. We don't really want to be regulated. We absolutely don't want to stifle innovation. And yet the people doing the regulations sometimes are not well informed at all about how things actually work and how to craft a regulation that's kind of like a decision line in machine learning. It's probably not just a straight line, like where everything on one side is good and everything on the other side is bad.
Definitely. Okay, there's so many directions we could go now. Just that little bit of your response, I want to dive deeper into. I'm going to go back slightly to what you were saying about there are areas you feel like where this is potentially dangerous, as being misused a little bit. And if you're open to it, I'd love to hear, do you have specific examples you could give us in what you're kind of referring to when it comes to the side where you see it not being effectively used and a little bit, problematic or dangerous?
Briefly, I think that the large language models, while incredibly impressive in what they're doing, and I think exceptionally useful for some things like creative generation, synthesis of documents and images and ideas in a space, and software, with a human in the loop checking things, where there's a lot of data on some of that. I think it's fabulous what they're able to do. I think there is way too much hype and extrapolation about, because these have gotten so smart so fast, therefore people will be obsolete in a certain amount of time. I think that is foolish and dangerous and harmful to people to talk like that. I think that the extrapolations there are completely ignoring the need for having an entity that has a mind, that knows what is true and false, that knows what matters, and that has emotional intelligence. So often the people hyping the models don't talk about the thousands of humans in the loop shaping it and teaching it, and how the model doesn't have a mind. So I just think that we need to be very careful when we hear the hype, and ask another question, which is, are the people hyping it, do they own stock in these companies? Are they just trying, because they usually
Absolutely.
do, and they're usually trying to pump it up, and press,
Of
good,
course.
bad, whatever, pumps up their values.
I think that's a really excellent point and thing to emphasize, of course, because as you said, that's probably one of the most common kind of fears amongst, I would say, the general public, right, around AI. I would love to hear if there's any resources you recommend or you think are doing a good job, or spaces, institutions, anything in that regard that you think are really leading the way and helping educate people on how that can be done most effectively.
Yeah, well, one of my favorites is one that came out of the Media Lab. It's called the Algorithmic Justice League. Joy Buolamwini and team there have just done an amazing job of, being grounded in the engineering, the science, the technology, and yet connecting with policymakers and leaders and helping them understand the opportunities to do better there.
Awesome. I definitely need to look into them more. Thank you for sharing that. And I want to get back to kind of more the policy side of things and the patenting side of things. And I'd love to hear just what do you see as the importance and, benefits of patenting and why you chose to patent your innovations, and how that's kind of played out over the years versus, I know you're also a proponent, a lot of your research is open source as well. So a little bit, if you could speak to that balance.
Yes, actually, I have default not patented. I've been told many times that my articles, my book, have prevented patents. We, in the Media Lab, our default position has been open sourcing our software and publishing and openly putting out our ideas and not patenting them. I am, however, listed on over 100 patents as a inventor.
That's what I was going to say. I was like, was I off in what I saw? Okay.
Yeah.
Just want to clarify.
That is, again, that is not my default position.
Okay,
probably there'd be
interesting.
hundreds more if that was my default position. Our default position is not to patent. Each of those patents was because a company requested that we patent, or I patent what we did. And that most of those were, I'm an academic and they wanted to do something commercial with it.
Got it. Okay.
Mostly I've been a fan of just putting things out there and letting people use them for free.
We have to take a quick break to hear from the wonderful people that make this show possible. After the break, we'll hear about the groundbreaking research and new wearable technology that Empatica created that's helping to save lives. And we're back to hear more of the fascinating story of Rosalind Picard's research and company. I'm your host, Magenta Strongheart, and when we left off, we were discussing the pros and cons to patenting research tech, and if it even makes sense to patent technology that's designed to help everyone. Thank you for your insights on that, and I want to get back to more of the fun stuff that you're doing. I would love for you to explain in detail the two companies that you founded, the Affectiva and Empatica, and tell us more about the kind of products and services that they're providing. I think they're really interesting and doing, a lot of good. And so I'd love for you for people who may not be familiar with what they're doing, the elevator pitch maybe for each.
Sure. The first company I co-founded with Ron El-Kalyoubi is called Affectiva. It's been acquired by SmartEye, a public Swedish company. The original goal was to be a company that provided the technology to help people to measure and make sense of affective signals from things like a wearable device and faces and voices, and do so in a scientifically rigorous way and do so in an ethical way, always with people's prior informed consent. We actually, even in the early days when starved for money, turned away possible funding from people who wanted to collect data without people's fully informed consent. So we stuck to that. And then today, Affectiva has been, well, actually 4 years, about 3 years into it, our CEO we'd hired decided that hardware in medical was too hard and canned all of that. I tried to do a spin out from a spin out, which I was told might have a 5% success rate of succeeding. It wound up not succeeding to do that. So I, fortunately, with MIT, I had my IP. I had access to it as inventor through the Media Lab. They give you that. So I just started back at square one with a new company to build a wearable. And that company, within a year, merged with Empatica SRL to form Empatica Inc. And Empatica today is selling and providing services and digital biomarkers that include an FDA-cleared smartwatch, an FDA-cleared platform, FDA-cleared biomarkers, totally focused on helping people succeed and getting the highest quality medical insights using wearable sensor data and AI technology. So that is, in a nutshell, what Empatica is offering today. It also grew out of a very crazy story path that was not at all anything I ever expected.
That's really interesting. And do those, just to make sure I understand correctly, are those products provided through other companies, like it's a B2B, or those go directly to consumers? for them to access the data themselves or with a care provider or something?
Affectiva sells mostly B2B and B to researchers who are collecting data. They mostly are doing improvement of safety in the automotive environment these days, safer driving experiences. At Empatica, where we're focused on medical, it's a little complicated. We sell to 3 different groups, really. We sell direct to consumers who have a diagnosis of epilepsy. We sell the best-selling wearable to detect the most life-threatening kind of seizure, the grand mal, or technically called the generalized tonic-clonic seizure. So a patient who has those kinds of seizures should not be alone. If they are alone and have those kinds of seizures, there's a 65 times higher risk of dying of a condition called SUDEP that they should talk to their doctor about if their doctor hasn't brought it up with them. So they should not be alone. They need something to alert to people to come and check on them when they have a seizure. We also sell directly at Empatica to people running both small research studies, usually academics, and large clinical trials, usually companies, medical companies and pharmaceutical companies working on treatments to improve lives. And they purchase sets of devices or digital biomarkers or services to help them collect objective data that gives them insights into things like the patient's activity levels, sleep changes, stress changes, a list of over 128 digital biomarkers that relate to everything from 6-minute walk tests to FDA cleared sleep wake timing.
That's really helpful to understand. Thank you for explaining a little more detail. And I'd love to hear just what's kind of a day in the life of Rosalind now. And you're managing all these different things, but also, of course, still continuing your research. And I'd love to hear what the kind of split of some of these responsibilities. Yeah, what does that look like for folks who might not know?
Oh, goodness. A day in the life. I'm not sure there's a typical day in the life. It's never boring. I'll tell you that. I get to fill my days usually talking with collaborators on our research projects. I have a lot of projects going. My priority at MIT is with my graduate students and our collaborators on those projects. So a typical day might involve, so for example, yesterday talking with leading collaborators at Harvard Medical School, Brigham and Women's Hospital, and in my lab about how to better understand the way that human sleep behaviors and activity behaviors relate to mental health and mood. So actually yesterday spent several hours going into the latest data, different ways to analyze the data, finding old data, new data, a lot of data analytics. Other meetings, we're talking with people about machine learning methods, the latest, how to improve them, how to help them work better for generalization, explainability on, data sets we haven't seen before. I also teach. I'm preparing lectures right now related to analysis of emotional information from speech and from physiology. So that was one day. I don't know what a typical day, but a typical day usually involves a lot of learning and brainstorming.
Wow. It sounds incredibly dynamic and a balance of a lot of different, I would say using a lot of different parts of your brain. So that's awesome. And I think what keeps things interesting in careers, of course, is being able to have that kind of dynamic day to day. I'd also be interested to know if you've had to go through some of those transitions from being more on the ground. I don't want to assume anything, but, in the weeds of the research to now having to manage these large teams and also balance, all these different kind of large institutions you're responsible for. And do you have any kind of tips or things you learned throughout maybe some of those growing processes that you think might be helpful for others who are going through that transition?
Definitely. I've learned a lot. Actually, one of the most important things I learned when one of my graduate students had a bad experience on an airline on his honeymoon. And the flight attendant handled it very poorly, which caused him to get so upset that he told their customer service people that he could build a computer that handles people's feelings better than the airline did. And he came to me to work on that. And we built the first technology that attempted to show empathy to people. First of all, it had to elicit frustration, which turned out to be so easy to do that we actually had a hard time doing a non-frustration control. We wound up with a high frustration condition and a low frustration condition. And then we randomized people to a situation where they got active listening and empathy, or just a friendly, chatty bot, or just a control. And we learned that the computer algorithm for displaying empathy, which was handcrafted then, okay, there's no real intelligence in it, just human intelligence anticipating a situation, trying to do a very emotionally intelligent thing. And that has probably been the most valuable skill I've learned from our work, and how to think about the difficult emotions somebody's going through, how to help them, kind of like not a perfect mirror holding up to it, but sort of trying to paraphrase, trying to show understanding, not just to understand, but to actually do the handshake metaphorically of repeating it back to them and really making an effort to see if what they hear from you is accurately what they feel. And that is incredibly effective. And it works whether one-on-one or trying to, address the feelings of a larger team.
Absolutely. No, that makes a ton of sense. And I love the note of kind of validating the understanding, not just, like you said, understanding is one thing, being a good listener, communicator, but even going that extra step to make sure they know you understood, or to make sure they have the opportunity to correct anything that might have been misunderstood.
Yes.
And one other question we like to ask, because we're hardware nerds and we build things, is what's on your personal bill of materials? And you can interpret it however you like.
Right now, my personal bill of materials is actually going back in time to build a wearable that helps a non-speaking person communicate their stress. We started off trying to do that years ago, and we know how to do it. But what we have right now is a little too fancy for what they need. So we're actually going back to some basics and working again with people who are experiencing a whole lot of stress and are being misunderstood, and working to come up with something that will help fix that.
That's awesome. I'm excited to kind of follow along the journey there. I watched your TED Talk, which I'm imagining this is kind of the work you're referring to, right? Is these early wearables for folks on the spectrum, if I'm not mistaken, and how they can communicate if they are nonverbal. So that's awesome to hear. And I just want to give you the opportunity, if there's anything else you want to share or call out or promote or anything, now's the time before we wrap up the conversation here.
Thank you. One thing that is the case today, and maybe and everybody could do a little something about it, is there are people with epilepsy who feel that they can't tell others about their epilepsy because it's stigmatized, and it shouldn't be stigmatized, because 1 in 26 people will get epilepsy, and anybody with a brain, which is everybody listening, it could happen to you or somebody you love. So I just encourage everybody to ask around, if they think they don't know somebody with epilepsy, to ask their friends, hey, I heard it's actually really common, but I don't think I know anybody, and ask around. And when you will find that you do know somebody. And I would just offer to them, if they still have active seizures, to be a support to them, to be willing to be added to their call list. If they have active seizures, they should not be alone at the time of a seizure. They should use a device like our FDA cleared one. They should make sure that they're not alone, because having somebody who's willing to be there for you can be life-saving. And that is something everybody listening could do.
That's wonderful. That's the perfect note, I think, to end on. So thank you so much, Rosalind. Thank you for your insight in so many realms across like leadership experience and careers in engineering, down to the nitty-gritty of tech development and building empathy. We covered a lot of ground, and I'm excited for others to hear this conversation. So thank you so much for the time today.
Thanks, Magenta.
That was Rosalind Picard and her insight into how to build more empathic computing systems, the right way to start a data-driven company, and why it's not always the best thing to patent something. Robots are becoming more and more commonplace in our daily lives, So it's vital that engineers learn from the work of experts like Rosalind in order to build a more empathic technological world. This has been The Bomb, Engineering a Path Forward. If you like The Bomb, don't forget to subscribe, rate, and share the show wherever you get your podcasts. You can follow SupplyFrame and Hackaday on Instagram, Twitter, LinkedIn, YouTube, and Design Lab at SupplyFrame Design Lab on Instagram and Twitter. The Bomb is a SupplyFrame podcast produced by me, Magenta Strongheart, and Ryan Tillotson. Written by Maggie Bowles and edited by Daniel Ferreira. Theme music is by Anna Hogbin, show art by Thomas Schneider, special thanks to Giovanni Salinas, Bruce Dominguez, Thomas Woodward, Jin Kumar, Jordan Clark, the entire SupplyFrame team, and you, our wonderful listeners. I'm your host, Magenta Strongheart. See you next week.